to go through pharmacokinetics and pharmacodynamics, and then we are going to do factors that influence how drugs work. Why is it that drug will not work the same for an adult or an old person and in a juvenile like maybe myself? And then we also do asthma and what we call autocoids. Those are the topics that will come in your test one, and it's gonna be an interesting journey. So let's move together. So here is the introduction to pharmacology and the therapeutics. So you can see we also have two terms here: pharmacology and therapeutics. So meaning we have to understand both terms. So to begin with, pharmacology itself is a branch of pharmaceutical sciences. Pharmaceutical sciences deals with drugs, pharmaceutic, and this is actually a course for pharmacy students, pharmaceutics. But for us, it's not much, right? Because ours is to prescribe, not really into how we can make the drugs not much. That is for pharmacists. But pharmacology is a branch of these pharmaceutical sciences concerned with the study of the interaction of chemical substances. And these chemical substances, we call them drugs, which exert biochemical or physiological effects on cells, tissues, organs, or your organism at large. So what we are simply saying is that if I've got a substance, substance A, if I take this substance, if I'm not feeling well, it can make me improve. That substance, that chemical substance is a drug. So you are studying now the way two drugs are going to be able to interact. So what happens if I take, let's say for example, I'm taking an antibiotic with an antifungal or any other drug, what do we expect to happen? So there are some combinations of drugs that you should never prescribe. The reason is that the very moment that you prescribe such a combination is you have killed the patient. That is it. Actually, some prescriptions, if you give them, they can also revoke your license as a medical doctor. You shall never practice again because they are so deadly combinations. So you want to make sure that you understand the interactions of these different drugs. And in pharmacology, you are giving a drug and then you are seeing how it is affecting the biochemical and physiological. How is it changing the function of the body? The body was supposed, if I'm supposed to be feeling cold, I take this blood. What is the effect on that homeostatic environment? Am I feeling cold still or I'm feeling warm? So you are looking at all those interactions of the drugs. So pharmacology is going to be the study of drugs and their interactions with living systems. That will include physical and chemical properties of a drug. You know, physical properties is what is it doing really to to what, if you consider a drug, when you take it, the physical, you are trying to talk about the basic component, the composition of a drug. Chemical is how is the drug is going to be working. And then the biochemical and physiological effects, what is it going to do on my body if I take this drug? The knowledge of the history, source, and use of drugs is also important in pharmacology. The history, how did the drug come about? Where did we get this drug, the source, and what are the uses of this drug? And you're going to find that one drug, today we are going to do one topic, we say it is used here. Next time we are going to go on another topic, we'll say it's also used here. And then when we go on another topic, we're going to say that this drug is actually going to be a very bad drug here. So drugs have got different ways in which they work and they are going to work at different places. And so we also are interested in understanding that. And then drug absorption, distribution, metabolism, and excretion. So this is going to be known as pharmacokinetics. I don't want you to waste much time for now because it is an entire topic. So a little bit of history of pharmacology. Actually, the knowledge of the usefulness and toxic effects of many plants and animal products have been known to man since ancient times. Several cultures, you can see the Greeks, the Chinese, the Indians, the Romans, the Europeans, all these contributed a great deal to the development of the modern medicine that we have. So the drug prescription included preparations from herbs. If someone is not feeling well, in the ancient times, they'll just say, okay, go and get that herb. And it has still remained even now, right? You go to a witch doctor, the witch doctor is just the guy doesn't just have money. So what he does is that when you come, because you trust him very much, you just tell the son, go behind, you start pulling the roots of the mango tree, and then they bring you, and then you pay a lot of money. So herbs we are prescribed, and actually animal and minerals, animal products can also be prescribed. For example, when you start talking about the thyroid gland, you see some anti-thyroid drugs, you can actually get from animal, the animal thyroid, okay, and then you'll be giving to human. So those are drugs. The father of modern pharmacology is Oswald. You can read that term. He's a general pharmacologist, but I don't want you also to be too much worried. Actually, he did contribute a lot to the way the pharmacology is that we know as at now. Not only him, of course, having a lot of other people that are contributing. If we say father, just like we say the father of modern genetics is Gregor Mendel, of course, we have got many more people that have contributed to the way genetics is, right? So that is a basic introduction. Now let's understand some terms when you're talking about pharmacology. Terminologies we need to know. The first terminology is the pharmacodynamics. If you can see, I've even highlighted the D there because we have got the two terms pharmacodynamics, pharmacokinetics. Even from the word kinetic, this is telling us about the speed, right? The rate of or how something is happening, how fast something is happening. So in pharmacodynamics, it is what the drug does to the body. So if I take the drug, what is the drug doing to my body? That is pharmacodynamics. D for drug does to the body. Pharmacokinetics is what the body is going to be doing to the drug. So it's just the opposite like that. That's how you basically remember this. So for in pharmacodynamics, these are entire topics. We'll do pharmacodynamics as an entire topic in the next class and pharmacokinetics. So pharmacodynamics is the physiological and biochemical effects of a drug and their mechanisms of action at system, organ, tissue, cellular, and the macromolecular level. So in other words, if I take in a drug, what is going to happen is this. When you take a drug, you know we have done hormones in physiology. That's why you never need, if you want pharmacology to be interesting, don't forget physiology, right? Because the way you are going to understand how a drug works is to look at the how the normal system works. So the drug will just come there to enhance how the normal system works. So when I take a drug, just like an hormone, it has got a receptor where it's supposed to attach. So in pharmacodynamics, I'm interested in understanding what is going to happen when the drug that I've taken interacts with a receptor. So if I take a drug, it's going to start interacting with the receptor, and that interaction with the receptor is now going to make that drug to cause a cascade of events. In physiology, we call it a signal transduction, and then that is going to overall lead to the action that the actual, let's say, hormone was supposed to cause if it attached to that receptor. Say for example, I'm talking about estrogen. We know estrogen, say if it attaches to a certain receptor, is causing the development of the secondary female characteristics. So if I give what we call agonist, an agonist is a drug that works like the normal hormone. So if I give an estrogen agonist, it is going to enhance the way estrogen is supposed to be working because it works on the same receptor, or at least in the mechanism that is going to lead to the same result. Hope that is okay. Pharmacodynamics is basically you understanding receptors and how the drug is working. So what is what the drug is going to do to the body once it attaches to the receptor. Pharmacokinetics is going to refer to the movement of the drug. Remember, it is kinetic. Kinetic is movement. So movement of the drug in the body and the alteration of the drug by the body. So it is what the body does to the drug. So what happens is this: when I take in the drug by mouth, the first thing that should happen is it should be absorbed. So there's going to be absorption. So we use the mnemonic ADME to refer to the processes that happen in pharmacokinetics. ADME. A is absorption. So I've taken in the drug by mouth, but it needs to move from the GIT to go into blood. So that is absorption. From absorption, we are going to have D, which is distribution. So the drug is now going to move from the blood, it is going to be distributed all over the body. And then after the distribution of the drug, we're going to have M, which is metabolism. Some drugs are supposed to be activated because when we take them, they are inactive. So they're supposed to be activated, while some drugs, in metabolism, they can be deactivated. So that is what is going to happen in metabolism. You are breaking down the drug in either active or inactive form. And then the E is excretion. Now that the drug has worked, it shouldn't be in the body forever. The problem is that if it remains in the body forever, it is going to start causing problems. Because anything that is good, too good of it is going to be bad, right? The same water that we love, if you take it too much, it can kill. So actually everything is a medicine. It can be a medicine, and at the same time everything is a poison. It just depends on how much you have taken. So that is pharmacokinetics. The drug has gone into the body, it has been absorbed, it has been distributed, it has been metabolized, it has been excreted. That is what the body is doing to the drug. Hope we have understood these two terms, pharmacodynamics and pharmacokinetics. Actually, when you go in an exam, just pharmacokinetics and pharmacodynamics, the first 20 MCQs are just from these two topics. So that's why we are going to break them well properly. And then we have got pharmacogenetics, even from the word genetics, right? Pharmacogenetics is the study of the genetic influence on responses to drugs. Why is it that actually when you there's going to be a topic that we are going to do later on in pharmacology on diuretics. So diuretics are drugs that cause you to lose water by increasing your urine output. So we're going to find that some diuretics are going to work very well in blacks in helping in heart failure, specifically in blacks. Why in blacks? That is genetics. So in pharmacogenetics, you are trying to understand the study of the genetic influence on response to drugs. Why is it that person B who has got this genetic makeup can respond to this drug while person C can't respond to the same drug? For example, if you come to malaria treatment, you are going to see that most of the drugs like malaria are going to have the quinines to treat it because of the parasite that causes malaria, Plasmodium falciparum, and other types of Plasmodium. So what happens is that in most of the world, these drugs cannot treat malaria because the malaria parasite has become resistant to them. It is only in few places of this entire earth. Why? So we're trying to also look at the genetic makeup. Okay. And then we also have pharmacogenomics. This is the use of genetic information to guide the choice of drug therapy on an individual basis. So you are looking at me as a human being, as an individual, not as a team, as an individual, as Mwansa. So when you look at me, you look at my genetic makeup. Now you want to decide which drug to give me. So that genetic information that you are using to be able to guide the choice of drug that you are going to give me as an individual, that's known as pharmacogenomics. Okay, hope that's okay. And then we have got pharmacotherapeutics, which is the application of pharmacological information together with knowledge of the disease for its prevention, mitigation, or cure. You are applying pharmacological information. Pharmacological information is you basically understanding a drug, how a drug works, what is the mechanism by which a drug works, what is the mode by which a drug works. Now, those are two terms, mode and mechanism. Let me give an example. For example, I can talk of antibiotics, drugs that we give when someone has got a bacterial infection. So, mechanism of action would be the actual way in which the drug is working. For example, the reason as to why bacteria cause infection to us is because they're going to form their own DNA and then they're going to continue growing in us. So we can give some drugs, for example, folic acid antagonists. So these folic acid antagonists will be stopping the formation of folic acid in the bacteria. If you stop the formation of folic acid, it means the bacteria will die. So that is a mechanism of action. That's how the drug is working. But mode of action, you are basically talking about what is the effect, the basic effect of that drug. Is it just there to stop the growth of the bacteria or to kill the bacteria? Because some drugs will actually just stop growth, some drugs will literally kill the bacteria. That's mode of action. Okay, so hope we get that. So pharmacotherapeutics is the application of the knowledge of pharmacology that we have together with knowledge of the disease so that we can be able to prevent it, to mitigate or cure. Selection of the most appropriate drug, the dose, duration of treatment taking into account the specific features of a patient are part of pharmacotherapeutics. Now, when you give a drug, why is it that for some drugs are going to give you to say take them for 2 days? Other drugs are going to tell you take them for a week. Others for a lifetime. That has to do with number one, how the organism that you are treating is. Some organisms, like for example viruses, it is nearly very hard to destroy them because they are ever changing in the way they work. So we're giving a drug just to weaken them and also to improve your immune system. For example, HIV. When someone gets HIV, what happens is HIV beats our white blood cells. White blood cell count is going to drop, and the white blood cells are the ones that fight infections in our bodies. So some drugs that will give will simply be to improve the white blood cell count. Okay, and so you can give it for a lifetime because if you stop giving, the white blood cell count will still reduce, and then the effect of the disease will come back. So pharmacotherapeutics, you are looking at what is the dose that I'm going to give for how long and all those related information. Do we have any question on these terminologies before we continue? Is there any question? Okay, good. We also have what we call clinical pharmacology. Of course, we have defined pharmacology, right? So, clinical pharmacology is the scientific study of drugs. It can be an old drug or a new drug. Do you know that there are some drugs that they used to use in the past, but right now they are not used because they've been removed from the market? Sometimes you just learn about them so that you are just aware, but you don't use them because they have got a lot of effects. That's why they were removed from the market. So in clinical pharmacology, we are simply studying those drugs in a man. And it is going to include pharmacodynamics, pharmacokinetics, all these investigations for pharmacokinetics and pharmacodynamics in health volunteers and in patients, evaluation of efficacy and safety of drugs and comparative trials with other forms of treatment, surveillance of patterns of drug use. So what we are simply saying is this: you have got two people, right? Person one and person two. Person one is sick, person two is not sick. So you are trying to see how the drug is going to be able to work in these people. So that's basically clinical pharmacology. The pharmacodynamic properties, what the body is, what the drug is going to be doing to the body, and the pharmacokinetic investigations, what the body is going to be doing to the drug. In other words, you are simply trying to see what are the effects of the drug, including the adverse effects of that drug. Like what are the harmful effects that the drug has? And the aim of this clinical pharmacology is to generate data for optimum use of drugs and the practice of evidence-based medicine. This is actually a topic. Evidence-based medicine is going to be last topics, and these are so much friendly topics at the end of the course of pharmacology. So in other words, what you're doing is, in clinical pharmacology, you are simply trying to understand how these drugs are going to be working and how you can generate data to help you to optimally use a drug. Because the problem when you give a drug and then it is not taken to the maximum point is that it will not be able to eradicate the infection of interest. And if that doesn't happen, the infection is going to come back, and it can be way, way detrimental if it comes back. So that's why you need to generate data of how you can use the medicine to the maximum point, and that's known as evidence-based medicine. So clinical pharmacology is going to focus on drug pharmacodynamics and pharmacokinetics in human, evaluation of the efficacy and safety of drugs. If I say efficacy, you are simply trying to look at, so we have got, I don't want to confuse you for now because we are going to discuss this in a detailed manner. But when you give a drug, I can give drug A and drug B. Drug, and I've given them in the same concentration. But you are going to find that drug A gets me better to the maximum. Drug B gets me just feeling better, but it's not to the maximum. So there is a difference in efficacy. Okay, there. So it's just the response that is being produced by the drug, that is efficacy. And on top here, okay, I'll not mention that. So again, you're also looking at pharmacotherapy, rational drug use. Rational drug use is how do you properly use a drug. Rational. You know, it's not everything that you prescribe a medicine for. For example, right now, if you go and ask for antibiotics, you actually don't buy most of the antibiotics over the counter. They are going to ask for a prescription. For example, you can't just go and say, I want, what drug can I give an example? You just go and say, I want metronidazole, I want no. Antibiotics, they are not given anyhow. You don't buy them over the counter because there's a lot of resistance. So in rational drug use, you want to make sure that you only use the drug when it is very, very necessary. Some drugs, even when they've been prescribed, some will even refuse to give you, even if they've been prescribed, because they know the greater effects that those drugs have and the resistance that they have. That's why if you go to the hospital, the doctor says, no, we will not give you this drug. And patients, you are going to find they are complaining, no, you just don't want me to get better. But the doctor knows why they've refused to give that drug. Some other terminologies, we have got toxicology. Just think of toxic, right? Toxic, something that is toxic, like your nothing. So something that is toxic, toxicology, the study of poisonous effects of drugs and other chemicals. Just the effects of the drug and any other chemicals. For example, in the house, we have got things like petrol, we can keep those things, gasoline, we can keep things like glue. Those things can have toxic effects. You know that glue is actually sniffed. It's actually one of those drugs that are abused, or not drug, but substances which are abused. Glue. So you are trying to see what are the bad effects that these things have. That's what we call toxicology, the study of the harmful effects. Even agricultural products. For example, you hear of organophosphate poisoning. We'll talk about it soon in when we start talking about sympathomimetics and parasympathomimetics. So you are trying to spray your veggies so that you kill insects, and then what happens that the same thing that you are trying to spray can actually come into you, and whether it touches your skin or you inhale it, these organophosphates, they are very, 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 very harmful. So we are also trying to look at their harmful effects with the emphasis on detection, prevention, and treatment of poisoning. In case someone poisoned, what should you do? Should you just look at them? There should be something that you do. Actually, for poisons, what happens that when you take a poison, we have got what we call antidotes, something that is going to reverse what the poison is doing. And most of the antidotes at least should work in an opposite way or be able to neutralize the poison. For example, if someone has taken too much paracetamol, they were trying to commit suicide, maybe they were in a heart break or something, they took a lot of paracetamol, there is an antidote, another drug that you are going to give, which is going to react with the paracetamol or the panadol, and then it will counter the effect, reducing the concentration of this. So in toxicology, you're not just looking at the effects of the harmful effects of the drug. What can you do to detect if it has been taken in, to prevent the effects of that drug, and also to treat the effect of that same drug? Okay, so you are going to include the study of adverse effects. Adverse effects, these are bad things that happen when you take a drug. Normally, not you've not abused really. It's the same concentration of the drug. And adverse effects happen because look, I get this drug A. If I take drug A, I'm taking it so that it helps me with headache, right? So it should go to, let's say, maybe the central nervous system. Maybe the headache is being caused by blood not going to the brain. So I need this drug to go and make the blood vessels on the head to dilate. But then you find that this same drug is also causing dilatation of blood vessels in the rest of the body. So what do you expect? There's going to be a drop in blood pressure in the rest of the body because of the vasodilatation. So that effect of the same drug in another part of the body where it wasn't intended to be used is what we call an adverse effect. So adverse effects come because of the same way the drug normally works, but it's the extension of the pharmacological effect, but then it's just working at a place where it is not supposed to be working. We also have chemotherapy. Some of you have heard of chemo. So chemotherapy or chemo is just a treatment of systemic infections. For example, if someone has got, let me give an example of a it's not nice, a malignancy of the blood or bone marrow. Say someone has got leukemia. Leukemia is a cancer of the white blood cells in which increase in the number of white blood cells. So what you can do is that you are going to give a drug that is going to go and kill all the white blood cells that are defective. But the problem of chemo is that it is not selective to only cancerous cells. It can also destroy normal cells. That is why chemo is not a simple process that you can do anyhow, because as you are killing cancerous cells, some cancerous cells look exactly like our own cells, so you'll be also killing your own cells. Okay, so that is chemotherapy. Treatment of systemic infection or malignancy. Malignancy is basically cancer with a specific drugs that have selective toxicity. And here we are saying selective toxicity because we are only interested in killing the organism or the malignant cell with minimal effect on the host cells. But even if we are trying to have this selective toxicity with this minimal effect on the host cells, there is still an effect on the host cells because of similarities between those malignant cells or infecting infective organisms with our own cells. Okay, hope that is okay. Is there any question up to here? Are we okay? Does anyone have a question? All right. So, drugs in general, therefore, can be pharmacodynamic agents or chemotherapeutic agents. Pharmacodynamic agents, these are designed to have pharmacodynamic effects in the recipient. Remember, pharmacodynamics is basically what the drug is doing to the body. So, pharmacodynamic agent is basically an agent that is designed to have pharmacodynamic properties. Properties for pharmacodynamic properties is basically what the drug is doing interacting with the receptors. When it interacts with the receptors, it now causes a signal transduction or a signal cascade to go that is going to result into a physiological action. And then chemotherapeutic agents, these are designed to just think of chemo is basically killing. And please, the important word in chemo is systemic infections. This is infection that is are in the entire body, not just at one point of the body, but the entire body. For example, when you start talking about bacteria in microbiology, we are going to talk about bacteria that are going to cause systemic infections. For example, like you have some bacteria that are going to cause infections that are localized to one place. Localization, you see things like carbuncles, furuncules. This is just where you look at your skin, there is like a ball. A carbuncle is a ball. Hope we know a ball. Like napafimbafi. And then you have got some bacteria. A bacteria like streptococcus causes systemic infection. The infection is going to go into blood And any time when the products of a microorganism goes into blood, just know that it's going through the rest of the body. So for such thing that has gone to the rest of the body, what do? You want to give a drug that is going to go also in the bloodstream in the rest of the body to attack wherever they see these infectious agents. So in chemotherapy, these chemotherapeutic agents, they are designed to inhibit or kill invading parasites, malignant cells, and have minimal or no pharmacodynamic effect in the recipient. But of course, they are going to have, even when they have got minimal effect in the recipient. Okay. We also have pharmacy. So pharmacy is the art, and this is art. You know what art is? It means that you can make it better. Say you are good at drawing. If you are not drawing, what happens? You will not be able to do it well. So it is an art. So pharmacy is an art, and at the same time it is a science. So you can learn it, at the same time you can improve it. So art and science of compounding and dispensing drugs. So it will include the collecting drugs, identifying drugs, purifying drugs, isolating drugs, also synthesizing these drugs, and standardization and quality control of medical substances, making them standard so that everyone will be able to use them on that standard that you've set of all these chemical substances. Pharmacocit- Pharmaceutics, because remember this course is the pharmacology and therapeutics, but is it pharmaceutics? This is a primary technological science. It's a primarily technological science. It deals with large scale manufacture of drugs. It's like pharmacy, but we are talking about the manufacture of drugs at a very large scale. That's pharmaceutics. And then pharmacopoeia is the official publication containing a list of drugs. And I can't forget this question. Okay. Pharmacopoeia is the official publication containing a list of drugs and medical preparations approved for use, their formulae, and other information needed to prepare a drug, their physical properties, tests for their identity, purity, and potency. So, in other words, we have got too many infections and too many diseases under the sun. And we have got a lot of medicines such that our brains might not really know them all. So the official publication, whether a book or a platform containing a list of the drugs and medical preparations approved for use, including also their formulas and other information, is what we call pharmacopoeia. Okay, just a publication containing a list of the drugs which have been approved. Please take note, approved. So each country may follow its own pharmacopoeia. It has got its own list of drugs which have been approved for use to guide its clinicians and pharmacists. For example, you have got the Indian pharmacopoeia, British pharmacopoeia, United States pharmacopoeia. So the list is revised at regular periods to delete obsolete drugs. As I said earlier, some drugs were there on the market, but right now they are no longer on the market. Why? Because we've stopped using them. Maybe of the bad effects that we never expected such drugs to have. So, before we continue, I've got some questions for you. Let's try out. We see if we are able to answer. What is a drug? What is a medicine? What is a poison? Let's start. Anyone thought, what do you think a drug is? From what you think, what is a drug? Anyone that has got a thought, please let's interact. I think this is going to be the best way to learn other than someone speaking and speaking and speaking. Anyone that wants to say something? What is a drug from what you feel or think? Messi, what is a drug? People, so we mean we take things we don't know? The same thing that you know is what I want you to say. Yes, please, I've seen a hand. Please go on. Thank you so much. I love that one. Any substance that is going to alter the physiology of the body. Thank you so much for that beautiful contribution. Anyone else that wants to add something? What they think a drug is? No one is thinking anything. Okay, what is a medicine? If we don't want to mention a drug, what is a medicine? Or who can differentiate a medicine from a drug? No, I just bought my meds. Yes, please. Okay, thank you so much. That is a beautiful one there. So basically, a drug is anything that you can take and is going to change the way the body is working. You have got things like heroin, marijuana. Those are drugs also. So a drug can either be used for medicinal purposes or it can act as a poison. So we have even now defined all the terms here, right? So that's a basic thing. So a drug is a chemical that affects the physiological processes of a living organism. And a very broad definition would include all chemicals other than food that affect living processes. So food is not a drug. And the World Health Organization defines a drug as any substance or product that is used or is intended to be used to modify or explore physiological systems or pathological states for the benefits of the recipient. So in this case, we are saying a drug should benefit the recipient according to WHO. And if the effect of the drug helps the body, the drug is a medicine. If the effect of that drug causes harm to the body, then that drug is a poison. The same chemical can be a medicine and at the same time can be a poison depending on conditions of use and the person using it. For example, some things, if you give them to children, some substances or some drugs, when you give them to children, they are going to be poison. If you give them to adults, you are going to they will be used as medicine. That's why you have got a dosage, specific dosage, and specific drugs for an age group. At the same time, also for the weight, that's why drugs will be also prescribed in kg. Okay, the kg of the patient that you are giving. For example, they are going to say this is you give 2 meals per kg of the patient. So meaning that if you give something beyond that, it's going to have bad effects. Remember in physics 1015, we used also to calculate dosages, if you remember at first year. Yes, that's important. But we're not going to do any calculations of dosages here unless pharmacy students. Now, when you look at drugs, drugs are going to have different names. The first name they're going to have is a chemical name. A chemical, you know chemistry, right? Chemical name describes the chemical composition and the molecular structure. For example, C2H what, H what. The chemical name is assigned according to the rules of nomenclature or for chemistry. For example, paracetamol, the chemical name is N4-hydroxyphenylethanamide or N4-hydroxyphenylacetamide. That is the chemistry. It's not that you should master that. And then a generic name, also known as non-proprietary name, is the name accepted by a competent scientific body or authority. For example, the United States adopted name and the British approved name. So I've got the USAN and BAN. So these are going to decide this is the name that we're going to be using for this drug. So the generic name is derived from the chemical name. Generic name is the common established name of a drug, irrespective of the person or the company that manufacture that drug. For example, paracetamol. The USA, the same paracetamol for them, they decide to the name they've given it is acetaminophen. So paracetamol acetaminophen, Panadol, it is the same thing. Okay. USA is acetaminophen. Just think of A for America. Yeah, that's their name, right? So that's a generic name. So it doesn't matter who makes this kind of drug, as long as it's having that chemical formula, it's going to be known as paracetamol. And the non-proprietary name or the generic name of newer drugs are kept uniform by an agreement to use the recommended international non-proprietary name in all member countries of the World Health Organization. So what we are saying is that imagine you make a new drug. How are you going to know the general name? So you are now going to keep the name of that new drug uniform by using, for all those countries that are under the World Health Organization, there's going to be what's known as a recommended international non-proprietary name. So that is what is going to be used. The British, the British approved name of other drugs as well has now been modified to be to commensurate with the recommended. In other words, the British approved names are now agreeing with the recommended international non-proprietary name. If they make a name of a drug, should also agree with the RINN. Now, some drugs, we are going to find that some drugs have got more than one generic name. And these are actually common drugs like meperidine and pethidine. These drugs, we call them opioids. Opioids are drugs that you can use to help with someone that has got pain. The first topic that we are going to do in a neuro pharmacology is going to be pain management. And pethidine is one of the best drugs that you give, especially for someone that is pregnant and someone that has got what we call the obstruction of the bowel canariculi, the bowel duct. Pethidine is a very good drug for that. It's an opioid. Other opioids includes things like cocaine, heroin, and then another drug that has got two names, which are generic names, is lidocaine. Lidocaine is also known as lignocaine. This drug is actually an anesthetic drug. Let's say, for example, you want to undergo, a lumbar puncture, right? They want to collect your cerebrospinal fluid, or you want to, you've people are just from doing the caudo equina. You want to paralyze these nerves which are down. You do a lumbar puncture. So you are going to give this local anesthetic, lignocaine or lidocaine. Actually, please know it even now, because when you'll be doing also lumbar puncture in your clinical skills, you're going to ask, name any one local anesthetic that is commonly used in lumbar puncture. This is the same one. So until the drug is included in a pharmacopoeia, that list we talked about of the approved drugs, the generic name may also be the approved name. Okay, the generic name is the same approved name that you'll be using, and then after its appearance in the official publication, it becomes the official name. You also have a trade name. A trade name is a drug. The drug has a register. Every drug is going to have a registered trademark. The use of the name is restricted by the drug's patent owner, like the person that has manufactured that drug. For example, the same paracetamol as acetaminophen, depending with who made it, can be called as Panado. This is a trade name. Panado, Tyleno, and in most cases, a drug bearing a generic name is equivalent to the same drug with a brand name. However, this equivalence is not always true. What we are saying is this: for example, I can say drug A is acetaminophen, right? And then another person makes a drug, and we know this acetaminophen has got also the trade name Panado. Now imagine another person, person B, makes the same drug, and then it has got the same chemical formula. So by having the same chemical formula, it's supposed to have the same generic name, isn't it? It should also be called acetaminophen. Now let's say that person, the manufacturer, instead of naming it also as Panado, they name it as Mwanza. So they've decided to give it another trade name. But normally, if you hear a drug's trade name, it's always correlating to the same drug that has got that generic name. But sometimes there can be a bit of differences. That's what we are simply saying. Okay. Although drugs are chemically equivalent, different manufacturing processes may cause differences in pharmacological actions. That's why you see, let me not talk about the drug. Maybe you're buying sugar. This is sugar, but maybe you have got sugar from this place, this sugar from this place is sweet. This sugar from this place is not sweet. Why? It's because of differences, maybe due to crystal size, isomers, the crystal hydration, purity. Maybe this one has got more impurities, and a lot of other things. Even if it's the same drug, but depending with who manufactured it, it can have a bit of slight difference in the way it is going to act. Okay, we already said that drugs can be classified as chemotherapeutic agents used to treat these infectious diseases, these cancers, systemic infections, and pharmacodynamic agents used in non-infectious diseases. And then should be the last things we're talking about, essential drugs. A drug that is known as an essential drug is one which, according to the WHO, is those drugs that satisfy the priority healthcare needs of the population and are intended to be available within the context of functioning health system at all times in adequate amounts, in appropriate dose forms, with assured quality and adequate information at a price the individual and the community can afford. We talked about pharmacopoeia. Pharmacopoeia is just a list of drugs that have been approved for use. Now, those drugs that have been approved for use, not all of them can be used always. Why? Some of them are too expensive. Some of them maybe the dosage is inappropriate. They say they give you my drug and then they say you should be taking it every after 2 hours. That is, compliance is going to be bad. The patient might not be able to follow that. That's why some diseases have ended up being showing resistance because patients don't adhere to what they were told. Maybe because the dosing is inappropriate, and also the drug should have assured quality and adequate information. The price is very important because imagine someone has got a flu. You tell them this drug, yeah, it's very good for flu. If you just take it right now, the flu is gone, but it is 2000. How many are going to manage getting that drug? So, an essential drug should be cheap, should be affordable to the, at least even those who are going to be considered a bit more on the lower economic side of life. Orphan drugs, these are drugs or biological products for diagnosis, treatment, prevention of a rare disease or condition or a more common disease that is endemic. An endemic disease is a disease that is always in an area. So you need to differentiate endemic, pandemic, epidemic. Endemic, it's always there. Like you are always with this infection throughout the year. Things like what? Things like cholera. Cholera is not endemic. It's not always there throughout the year. You know, you've got those things that you always survive with throughout the year. They are normal things like headache, those are endemic. But then it becomes an epidemic if it goes beyond the normal cases. For example, cholera might be there throughout the year. But then, like right now, the cases have increased a bit more than the normal that you are expecting. That becomes an epidemic. Okay. And then if this epidemic crosses the border, it is in Zambia, it is in South Africa, it is also in another country, it becomes a pandemic where it crosses borders. So an orphan drug is basically a drug that you are going to use for diagnosis. Diagnosis is finding out what is wrong. Okay, if someone comes to me to the hospital, they are saying they are complaining of, let's say, chest pain, they have got edema, they have got swelling on the legs, and then they are having difficulties in breathing. They are also having, let's say for example, the jugular vein is distended. The diagnosis for that condition is going to be congestive heart failure. They have got heart failure because of looking at what they are complaining of. So that is what we call diagnosis, finding out the problem that someone has. So some drugs can be used for diagnosis. For example, when you start talking about myasthenia gravis, there is a certain drug that we can give. If someone starts improving after give them that drug, maybe they came with weaknesses to you as a doctor. You give them this drug at low doses, they improve a bit. You are going to tell that this one has got has got myasthenia gravis. That's diagnosis. So orphan drugs are used for diagnosis, treatment, and prevention of rare diseases or conditions. Okay. So the list of orphan drugs include fomepizole, digoxin immune antibodies. Digoxin immune antibodies. We know digoxin. I think this is one of the drugs that we should have been tested in test one in physiology. It is a drug that blocks the sodium potassium ATPase pump, and the digoxin immune antibody is an antidote to digoxin. Antidote, so meaning that if someone has taken digoxin in overdose, you want to prevent the effect of digoxin, you can give them the digoxin immune antibodies. So that is it with the introduction to pharmacology as a topic. So we are now going to these questions. I want us to answer them. Please, it's not me answering, right? We've discussed together here. So it is us answering. Let's start number one. Which of the following is a branch of pharmaceutical sciences that study drugs origin, composition, pharmacokinetics, therapeutic use, and toxicology? Pharmacology, therapeutics, pharmacy, pharmacogenetics. Which one can you pick? A, very good. So yeah, pharmacology is a branch of pharmaceutical science that will study the origin of the drug, composition, pharmacokinetics, therapeutic use, and also the effects, bad effects. Drugs used for a rare disease or condition or common in resource poor countries. Remember, resource poor countries. So used for rare disease or condition or common in resource poor countries. What is the name of that drug? What do we call such drugs? It's the last thing we are from talking about. Yes, please. Orphan drugs, very good. Pharmacological and non-pharmacological interventions used to prevent, control, or treat a disease. Pharmacological or non-pharmacological. Pharmacological interventions, if someone has got a disease, pharmacological interventions is me giving them a drug. But non-pharmacological interventions includes maybe telling them go and exercise, go and just continue drinking water. Okay, go and stop doing this. That is non-pharmacological. We're not giving them a drug. So the pharmacological and non-pharmacological interventions used to prevent, control, or treat disease. What is it known as? Remember, the name of the course is pharmacology therapeutics. So we have got the pharmacology where we're giving them drugs, and the therapeutics where you can also give them non-pharmacological intervention. So this is therapeutics. Drug nomenclature classification used by lay people. If we say lay people, layman's language, these are people that are not experts in something. Okay. So the drug name, which is nomenclature, which is used for lay people. Which nomenclature is it? Is it the trade name, the generic name, or the chemical name? So it is the trade name. Things like Panado. Let people say Panado, and the trade name is actually also known as the proprietary name, right? And then the non-proprietary is the generic name. Describe the drug nomenclature classification used when terms like anti-cancer or antibiotics drugs are used. We really mentioned this. About anti-cancers, remember drugs that are used for malignance, we said drugs can be classified into two: chemotherapeutic agents and pharmacodynamic agents. So those drug nomenclature that talks about anti-cancers, antibiotics, what do we call them? That fight systemic infections. Nothing. So that's it. Chemotherapeutic drugs. Scientific study of pharmacodynamic and pharmacokinetic investigations of drugs. So we did also mention that's clinical pharmacology, right? You are looking at the pharmacodynamics and pharmacokinetics. Accepted drug nomenclature classification used by clinicians to prescribe drugs. Which one is that? The one which is used by clinicians to prescribe drugs? That's the non-proprietary name, right? The generic name. Applying pharmacological and disease factors to prevention, control, or cure of diseases. Pharmacological, applying pharmacological and disease factors. That's C, pharmaco, pharmacotherapeutics. What does the M stand for in the acronym ADME? We did mention this, isn't it? Yes, please. Metabolism, very good. Study of genetic influences on response to drugs. What do we call that? Genetic influences on response to drug. Yes, pharmacogenetics, very good. Drug nomenclature classification used by lay people already answered. A substance or drug that causes a harmful effect to the body. What do we call that one? A poison, good. Describes the drug nomenclature classification used when terms like anti-cancer, we already answered that. Official publication. These actually, anyway, you are going to see the past papers. These are exam questions. Official publication containing a list of drugs for use, their formula, and tests to determine their identity, purity, and potency. What do we call that? Official publication containing a list of drugs for use. Pharmacopoeia, good. Drugs meant to satisfy the priority healthcare needs of the population. For example, they should be cheap, they should have a good dosing. What do we call those? Essential drugs, excellent. Study of physiological and biochemical effects of drug and their mechanism of action at various levels of the body. Remember the effect what the drug does to the body. What do we call that? Pharmacodynamics. Right? Studies of drugs, the origin, composition, pharmacokinetics, therapeutic use, and toxicology. You can see we are basically mentioning everything, and this was an MCQ area. What do we call that? So the study of the origin, composition, pharmacokinetics, therapeutic use, and toxicology. That's known as pharmacology. Drugs used for a rare disease or condition or common in resource poor countries. Already answered this, isn't it? Orphan drugs. Describe the drug nomenclature classification used when terms like antihypertensive, analgesic drugs are used. Describes the drug nomenclature. Remember the nomenclature we have got two: chemotherapeutic and the pharmacodynamic. And we said for chemotherapeutic is just for those which are used for cancer and systemic infection. So anything else will be pharmacodynamic agent, like the antihypertensives and the analgesics. Analgesics are drugs that you give to relieve someone of pain. Pharmacological and non-pharmacological interventions used to prevent, control, or treat diseases. What is that? We already answered this question. Therapeutics, good. Component of pharmacology considers the absorption, distribution, metabolism, and excretion of drugs, ADME. So, which component of pharmacology talks about this? It's a Kinetics. Remember, absorb, distribute, metabolism, excrete. That's movement. So kinetics. Except a drug nomenclature classification used by clinicians. We already answered that. Scientific study of pharmacology, pharmacodynamics and pharmacokinetics. We already answered that. Any substance or product used to modify, explore physiological systems, treat or prevent diseases. What do we call that? A drug, isn't it? Treatment of infectious and malignancies with drugs with selective toxicity for the infective organism or malignant cells with minimal effect on the host cells. What is that called? Chemotherapy. Good. Route of administration, salbutamol inhaler that only works on beta. No, this one is not for this topic. Study of poisonous effects of drugs and other chemicals. Poisonous effects. Toxicology. Good. Route of administration. Anyway, this one you can answer. Route of administration of salbutamol inhaler that only works on beta receptors. So when it comes to routes of administration, some drugs can only work on a specific receptor that's known as local, while some drugs will work throughout the body because they go into blood. That's known as systemic. Okay. So that is it with the introduction to pharmacology.